Hi, my name is Michael Clery. I am an emergency medicine physician at Grady Hospital and assistant professor of emergency medicine with Emory University School of Medicine. I'd like to share with you today the ways that the Women's Resource Center to End Domestic Violence has been instrumental in taking care of some of our patients who have suffered from injuries of domestic violence. Unfortunately, during this COVID-19 pandemic, in the emergency department, we are seeing an increase in patients being injured by domestic violence, and at the same time, a reduction in the capacity across the city to provide safe shelter. Um, when I approached the Women's Resource Center, we were faced with oftentimes finding that at the end of a treatment plan, we had no safe destination for patients. When we had this discussion, the Women's Resource Center stepped up almost immediately to take on that responsibility to meet the needs of patients who are suffering from or at risk of domestic violence and help them find a safe plan, whether that is in a local shelter resource, through emergency shelter in a hotel, um, or even in transportation to a safe family environment outside of the state. We've seen this already have an important impact for patients that we're treating in the ED within the last month. I think it's important to know how swiftly and decisively this organization recognized the need and formed a plan that has been carried out in order to meet a very important need in order to achieve safety for patients who otherwise had no other options. It's something that is incredibly moving to me as a ER doctor, and something I applaud. I really hope that you will consider supporting the Women's Resource Center financially and um, in raising support as best you can, because our patients will continue to benefit from their services even through the end of the pandemic and onward. Thank you.